Okay, great. So, hello everybody. Welcome to Start Strong 2021. My name is Shae Sterrett, and I'm so excited to introduce you to Nadine Hottat. And she is a, a doula, a midwife. Is it a licensed nurse practitioner, registered?
I'm sorry.
Yeah. No, that's okay. So many acronyms.
Mhm.
And then also, of course, the subject of the topic today is, this emerging field of cannabis as good medicine, which is something that she's become really well versed in. And I know that this is a really popular emerging topic as you look in different places around the country. And I know you're going to speak to this so much more, but cannabis has been around for thousands and thousands of years. And so I think it's very natural that this type of product, whatever you might want to call it, is starting to emerge again with these medicinal deeper properties. So I'm really excited that you're here to talk to us about it. So just a reminder before we get started that this presentation is being recorded. So if for some reason you don't want to have your likeness recorded, please just turn off your video and your audio. And then I will pass it on to Nadine. I think she has a presentation for us.
I do.
Thanks
Hi.
for being here.
Greetings.
Hello. Hi.
Hi. Okay. So first off, I want to just let this be informal and conversational. So, you can interrupt me at any time with questions, or if you want me to expand on something I'm speaking about, something that's on the slide. I'm going to move through slides, but this is not meant to be a lecture, so just chime in either in chat or unmute yourself or what. I don't quite know how that works, but I welcome conversation. And so I'm gonna bring up my slides to get us started. That works, hey?
Perfect.
You see it? Okay.
Yes, ma'am.
Okay.
Yeah,
So I want to talk about cannabis medicine today. And I'm going to tell you a little bit about myself and just how I got into this. And my slides are in a PDF format here. So I am, all those acronyms Shae was trying to talk about. I'm an advanced practice nurse, and my specialty, my training was as a nurse midwife. So, advanced practice nurse is in the same category as a nurse practitioner, but my certification is as a nurse midwife. And my work is really focused on women's health. I don't really attend births anymore. I did for a time, but my work has really focused on integrative medicine, particularly for women. I work with, as I say on the slide here, botanical medicine, so natural nutritional medicines, and a lot of mind-body work, and functional medicine to some degree, which is really what you call root cause medicine, looking at what might be underneath symptoms and underneath illness. I do a lot of work with particularly women with chronic illnesses, pain conditions, mood imbalances and disorders. And I've always been friendly with cannabis in my life. I always, from a teenager, I didn't always smoke cannabis, but I used it as a teenager and off and on in my adult life. I've spent the last 15 years dividing my time between United States and Jamaica, where I am right now. And so in Jamaica, they call it ganja. It's a very big part of the culture here. So I've just been around it a lot in my life. But when cannabis began to be legalized as, for medicinal use, I was kind of following it from the sidelines and interested in this whole shift. It was just such a profound shift. And this was several years ago, I don't know how many years ago now, 3, maybe 4 years ago, I saw that there was a medical school, the University of Vermont Medical School was um, offering a certification program in cannabis therapeutics. And I didn't take that program, but it really got me thinking like, wow, this is a medical school. That was the first medical school in the country to offer training in cannabis medicine. And it really said something to me like, this is really coming to a level where professionals are needing to learn about this. And dispensaries were opening, people were getting enrolled, getting medical cannabis cards and going to get, their different kinds of cannabis medicines. But very few doctors and nurses really knew anything about it, or very few doctors or nurses were even willing to talk about it. And so I just realized that we need to understand this and we need to step up to the plate and learn about this and be able to have these conversations and support patients who are interested in this. And so I began to do some training, and then the more I studied it and learned about it, the more compelling it became. It's such an incredibly interesting topic. So I started doing training, and then after a certain level of training, because I'm an advanced practice nurse, in the state of New Hampshire, where I'm licensed, I am able to do certification for people. So I enrolled my very first person. I can provide the certification that this person has a qualifying condition and that we're working together. And I enrolled my first patient, who was a woman with very kind of complex, long-standing pain condition, a chronic pain condition. And she had really remarkable results really quickly. And this woman had been through everything, every medication, every, procedure, all kinds of stuff. And it was really stunning to see how quickly she found improvement. So I just kept going and studying more. And then I went and did some on-site training with a doctor in Portland, Maine, who's a real expert in medical cannabis, and sat with him in his office for 3 days while he saw patients and saw people, all different kinds of situations, elders coming in, children with autism, people with pain, people with mood disorders, just cancer, all kinds of things, and just watched what happened. And I had never really experienced something like that in all my clinical training, where the quality of the experience that people were getting from this plant was very moving. And so over the last couple of years, I continue to weave that into my practice. When people are interested, we work with cannabis medicine. I do consultations for people who are interested, people who want to get enrolled in the program, get a card. I can do that if they have a qualifying condition. And people who are already using it who might want more guidance, because it's patient-led, it's safe, but there's a lot to it. And so cannabis, we say cannabis works best with education. So we really find that with some basic education about how to use it optimally, people can get a tremendous amount of benefit from this plant.
Yeah, I think one thing that's been coming up for me as I was just getting more familiar with the cannabis medicine is, and this came up a little bit even when we were talking about essential oils earlier this morning, is a much more natural way to establish a sense of wellness and health within ourselves, outside of the pharmaceutical market. And so I don't know how cannabis works in terms of like you hear about these lingering after effects and these side effects of some of these other, medications that people might use for things. And I wonder how cannabis works.
Yeah.
Should make any sense.
It does. Well, let me start to move through the slides a little bit, and then we'll touch on a lot of things. And I just wanted to say to you, Shae, that if there's anybody like commenting or questioning in Facebook that I don't see, you'll let me know.
Yes,
right?
absolutely. Yeah. I've got that up here.
Okay. So I put in these slides a few quotes from some prominent people working with cannabis, doctors and others, and I just want to share some of these. This is Donald Abrams. He does some incredible work with cancer, integrative oncologist. He is in San Francisco, and he's been a real pioneer with medical cannabis, like way ahead of talking about it and trying to get research done on it long before many others jumped on the bandwagon. He's a phenomenal guy. And he says here, he's a cancer doctor. I suggest to my patients they consider marijuana for their loss of appetite, nausea, pain, depression, and insomnia. That's one medicine they can use instead of 5. And this is really true. Like cannabis can touch on all of those issues that are so common for people going through cancer treatment. And we'll talk about why it can do that. Here's another one. This is from Jocelyn Elders, who was the Surgeon General. And again, she was just saying the evidence is overwhelming that cannabis can be beneficial for many symptoms and illnesses. And it does it with remarkable safety. And this is really true. She says marijuana is less toxic than many of the drugs that physicians prescribe every day. True, and I'll talk about safety, but it's a very safe plant. Sanjay Gupta, who's like a CNN doctor, I guess. I know there's a lot of words on these slides, but I think the story with Sanjay Gupta is that he initially put out a lot of opinion that I think he was against legalization, and he didn't think that cannabis really was had so much medicinal use, and that it wasn't safe. And then he came around. He was the one, if anybody is familiar with the story of cannabis medicine and prohibition and legalization, but Sanjay Gupta did a documentary about a little girl named Charlotte who had intractable seizures. And she, meaning a seizure disorder that was uncontrolled by all the conventional pharmaceuticals. And her family ended up working with kind of this network of underground people who were working with cannabis medicinally, and she began using a high CBD oil, and it, for the first time in her life, I forget, maybe she was 5 or 6 years old when they started giving her the CBD. It completely turned around her health and stopped her seizures, or brought them down from 35 a day to once or twice a week. And that's literally true. This kind of children with this kind of seizure disorder can have 20 to 50 seizures every day. And so he did a story on that, and then he really began to study what was going on, and realized that he had really been duped, that cannabis was not a unsafe, dangerous substance, and that it had abundant research to affirm its medicinal properties, and thousands of people all over the world using it successfully to treat a lot of symptoms. So the story of cannabis prohibition, why it became illegal and why it has been listed it as it's considered a Schedule 1 substance. So the pharmaceutical industry, the DEA, Drug Enforcement Agency, has categories for controlled substances. And the most prohibited and severely restricted category is called the Schedule 1. Heroin's in there, cocaine, or actually cocaine might be in level 2, in Schedule 2. And this is a category that is considered drugs that have no medicinal value and high potential for abuse. And even the government knows cannabis is not a dangerous drug and does have medicinal use, and it should not be in the same category with the most dangerous substances. And he really came back around and really championed helping to change the public perceptions around cannabis as a dangerous drug. This is Bonnie Goldstein. She's a doctor in California, and Bonnie she's been working with primarily a pediatric population most of her life, and she moved after working, I think, as a pediatric emergency physician, kind of got interested in cannabis in treating children, and in children with seizures and cancer treatment, and now she's a really well-respected specialist in medical cannabis. And Bonnie speaks of seeing sick and desperate patients have a complete turnaround in the quality of their lives. And she says here, cannabis medicine must be available as an option or alternative to current first-line treatments, especially if those treatments have harmful or potentially fatal side effects. And she goes on to say, if a pharmaceutical with the properties of cannabis were synthetically created and introduced today, the medical community would embrace it with open arms and tout it as a miracle drug. That's a very potent declaration. And so we really have to ask ourselves, what do these doctors know what's really happening? And how can we begin to change the stigma around cannabis? There's still a tremendous amount of stigma and judgment and fear about cannabis use in general, and medical cannabis as well. This is a beautiful quote that comes from Bonnie's second book called Cannabis is Medicine. And this really touched my heart. It's an excerpt from a patient's story. This woman had a chronic illness. I'm not sure exactly what it was, but it might have been progressive rheumatoid arthritis. She was very sick for decades. And she speaks of having at one time been a singer, and how music and singing songs and humming and was such a part of her life, such a precious part of her life. And over the years of her being sick, she less and less found herself singing, and she was kind of losing her voice and becoming more withdrawn and depressed and unhappy. And she began to be treated with medical cannabis, and she tells a story of how she little by little began to sing again, how to find her voice again. And that's what she's referring to when she says that cannabis helped me to unlock the box in which I've kept my own personal songbird. And she describes, if anyone knows how it feels to be trapped in a constantly malfunctioning body, they would realize what an enormous gift it is to feel well, to feel strong and capable at something again for the first time in over a decade. I was locked in a prison of illness and pain, and cannabis unlocked the door for me to break free. I want to tell you that these stories are absolutely real. I've listened to so many people describe how cannabis medicine made such a profound shift in their life, and particularly people with very hard to treat illnesses. And there's an explanation for that I will get to perhaps, but people who have gone through, every pharmaceutical indicated for their condition with all kinds of side effects and less than beneficial effects. And when they use cannabis as a medicine, they begin to experience a level of relief that they've never felt before. There's thousands and thousands of people all over the world who have similar kinds of stories to tell, and it's really moving, because in medicine you don't hear that very much. How often do you hear people speak of, a plant, a botanical, a safe, non-toxic, almost entirely side effect free treatment brings so much healing and so much change? So it's a really amazing experience. So a lot of people, this presentation is, I'm going to touch on lots of things, and just redirect me if you want to stop me. So this is a picture of the cannabis flower. Cannabis sativa is the actual official name for what people have been calling marijuana for a long time. There is evidence to make us aware that this plant has been used, as Shae said initially, for literally thousands of years. I believe that the first like archaeological, medical, anthropology, whatever it is, evidence of cannabis being used medicinally dates back to 2,500 years ago to China. I believe that's the oldest one that they've got now. Yeah, all over the world for thousands of years. So there's tons and tons of stories and research and timelines to show. I think they found cannabis plant in a Egyptian tomb or something. It's been used in lots of ways. So this is not a new thing that all of a sudden everybody discovered in the last couple decades. In fact, cannabis was part of the American pharmacopoeia, which is the what do you call it? Kind of the book of approved pharmaceutical substances until the early 1930s. So there were many pharmacies had lots of remedies that included cannabis tinctures in their formulas. And it wasn't until the 1930s that this became prohibited. And I'm not going to go into the story of prohibition, but if you are interested in this topic, I would really encourage you to do a little research on what really happened that took cannabis out of the mainstream as considered a medicinal plant and used in pharmacies and treatments. It wasn't about safety. It wasn't about any problems with the medicine. It was about social control and racism. And it's a very interesting story.
Yeah, I only recently learned that, actually. I was taking a training with the Prison Yoga Project, and we were talking a lot about racism in America, and then it led me to that story of how marijuana in like the late 70s, early 80s, that's when the shift seemed to really take place. And it's a really fascinating story. So I'll see if I can find a share on that. Yeah, I think it's really important, and this, but as this emerges, where that stigma came from and how we can get rid of it so it can be more accessible to people.
Yes, exactly. Yeah. So kind of want to breeze through a little bit how things began to shift, and we began to see, I don't know if you all can hear my yapping dog in the background. Let me know if that's annoying. It's like inevitable whenever I get on a Zoom call or something, my dogs start barking. They're like children when you try to get on the phone call. In the 60s, there were some researchers in Israel who became interested in, okay, what is it in cannabis? Basically, I think it started that they were just wondering, why does it make people high? What is creating this psychoactive effect? And began to study the compounds in and were able to isolate the first uh, most abundant compounds in cannabis, which are THC and CBD, which you probably have heard of. And they could see these active compounds. They did some really interesting research to trace those compounds and put like little radioactive tracers, I believe, on the compounds and watched where they went in the body. And they saw that they could see that these compounds were being taken up by cells and in various parts of the body. Receptors were receiving these compounds and creating these different, initially they were looking at the psychoactive effects, and they saw that it was going to the brain and right to directly to these receptors on the cells in certain parts of the brain. And they over time, basically they just kept studying, so what's going on, and it became evident. I mean, it was kind of a logical next step to think, okay, if these compounds in cannabis interact directly with receptors on in the human being and cause these effects, what are those receptors there for? They can't be there for cannabis, right? Like you wouldn't have these receptors made specifically for cannabis, but these compounds in cannabis fit into these receptors like a key into a lock and cause these physiological changes. So what are those receptors? They had never really identified those receptors until that time. And they then began to study these receptors and see what other compounds were happening inside the body affecting those receptors, and began to realize that the body makes its own compounds very similar to the active compounds in cannabis. This is Ethan Russo, who is also an incredible man. I think he's a neurologist by training, and is now focuses entirely on cannabis, and has some fascinating research on it. And it describes here that he thinks it's the most versatile remedy and the most useful plant on earth. That's a pretty powerful statement.
Wow.
A lot of people will say, oh, there's not enough research. We don't have enough research to really be confident on medical cannabis. And really, we can put that behind us. This is like one of the most abundantly studied plants on the planet. There are thousands and thousands of well reviewed and well researched articles on cannabis. When I look at the medical literature on cannabis, it is so complex. I can't even tell you. Like they're getting so complex with it. They're getting into really micro chemistry of it. And so it's very thorough. It's very ongoing. There are obstacles to research on cannabis. There's a lot of research on cannabis, but there are obstacles to good research, and that is primarily in this country because of the federal prohibition, that it's still considered on the federal level a Schedule I substance, and so that limits the amount of research that can be done on human subjects, basically.
Is that
But that's not so in
is that because the federal government doesn't offer the grants and stuff that they might offer to other studies on other?
Yes,
Yeah.
yes, that's part of it. And there's just ethics issues because it's considered it's still in the category of along with the most dangerous pharmaceuticals. Then you can't do studies on humans at the level that we need in order to verify what we're seeing clinically, anecdotally. So that's part of it. It's a complex situation, but yes, there's not the universities can't sponsor a lot of research unless they jump through a bazillion hoops because of the federal situation. So this is what I was starting to talk about a minute ago, that as they began to study these receptors and figure out why do we have these receptors in our brains, initially they just found them in the brain, but as they've gone on, they've seen that there's receptors throughout the body. And they began to study deeper and deeper and began to realize that, okay, our bodies make molecules that are structurally almost identical to these active compounds in cannabis. And there is a system of receptors, cell receptors, and these physiological compounds that are made on demand by our body within every human being and most animals. And this was a true physiological system that was not known about until the last 30 years or so. And so it's like new knowledge, new understanding that a lot of people who've gone through medical training in the past never learned about this at all. It was like they didn't know that there was this physiological system, and it's been named the endocannabinoid system now. So it's a very important and very active part of every human body. And Bonnie Goldstein, I love this quote. She says, "To those who don't believe in cannabis as medicine, I ask, do you know about the endocannabinoid system and what medical conditions are associated with its dysfunction? If they cannot answer this question, they are not knowledgeable enough to comment on cannabis as medicine." So the state of the scientific understanding of cannabis now has made us understand a system in the body that cannabis actually targets. It goes to those same receptors, and there is a whole incredible purpose for these receptors and these chemical compounds in the body. And if you don't understand that aspect of medical cannabis, you're not qualified to have an opinion about whether cannabis is a good medicine or not. That's a powerful statement, but it's true.
And Nadine, what are some of those medical conditions, or is that what you're going to talk about now?
We are going to go to that. I'll move through.
Okay.
Absolutely. So, so let me say a little bit about what this internal endocannabinoid system is. So right now, don't think about cannabis, the plant. Just think about what the research around cannabis has helped us understand, that we have this system. You could think of neurotransmitters, think about like dopamine and serotonin and neurotransmitters that we have in our body that are like cell signalers that tell cells to initiate physiological changes, create physiological changes. Everything is connected, one cell speaking to another and creating all this incredible processes in our body. So don't think about cannabis for a minute, but let's think about our own endocannabinoid system. This is a system in our body. And what the purpose of this system of we'll call them neurotransmitters. It's not exactly that, but you can call it that. What their purpose is to help your body maintain stability of its internal environment by regulating the flow of chemical messages sent between cells. Okay, so imagine if, the cells are responding to all the different inputs of both internal things going on, external things going on. We're always in movement and in flux. The body is responding to changes and what it needs to do to maintain a certain level of stability, right? We can't, our temperature has to be a certain level, our pH has to be a certain level. If you get over firing of certain neurons. You may get pain signals that are, you know, not necessarily correlate to the injury, for instance, or seizures. You know, this is like a overexcitation of certain neurons in the brain. They're sending out too many signals and causing this electrical imbalance. That's what a seizure might be. There's so many, you know, examples of the body needing to regulate these signals going from cell to cell. And the endocannabinoid system is like a feedback system that discerns if there's too much of something pumping out or too little of something pumping out, and will send its chemical messenger to the cell it needs to send it to tell it, okay, we need you to turn down the, you know, this, or turn up the that. And this is throughout the body. It's in the brain, it's in the immune system, it's in the digestive system, it's in the reproductive system. These receptors are found on cells throughout the body, which is why cannabis can be effective for so many conditions. Because a lot of people say, how can one plant treat so many conditions? The fact is that it's interacting with receptors throughout the body that have this purpose of helping to create balance. So you can see all those systems that this research shows the endocannabinoid system involved in all these things. So if you look at this, Karen, you can start to imagine medical conditions that cannabis might be appropriate for. And we'll go into that a little more. And chime in if you want.
I just find it interesting because I have had a long-term relationship with cannabinoids also, but I'm also a nurse. And so it's interesting to know the physiological piece of it.
Yeah, exactly. And this is why this kind of education, especially for healthcare providers, can be so important, you know, because when we can understand the physiology, then we can get over some of the skepticism and fear. And so I know look how fast the time is going. So I'm going to move through these faster and just talk about what is most interesting to you, because we don't have to get too scientific about it. But this is speaking about the compounds that are in the body, made on demand in the body when it needs to signal to cells to do something to stabilize whatever's going on. These are the two primary ones that have been identified in the body, anandamide and 2-AG. This talks about the receptors, you know, so these receptors are found on cells throughout the body. There are two primary receptors for the endocannabinoids, and these are called CB1 and CB2 receptors. CB1 receptors are found primarily in the brain. THC in cannabis is what acts particularly on those CB1 receptors, and that's why we get kind of consciousness altering effects from THC. I'm going to say right here, this is an interesting thing. There are none of these receptors found in the areas of the brain that control respiration and cardiac function. Now, where there are opioid receptors, this is why people die of opioid overdoses, because their respiratory function and cardiac function can become slowed to the point that they're not compatible with life. Those receptors are not found in those areas of the brain. So there are no known fatal doses of cannabis. Uh-oh, I just got a message. My internet connection is unstable. Can you all hear me still?
Yes.
Okay. Yeah. All right. So this is talking about all the compounds that are in cannabis. The two most frequently known are THC and CBD. THC is the one that causes the intoxication, you might say. CBD does not do that in the same way that THC does. And there are many, many more, and we're doing more and more study on these other compounds and finding them to be medicinally active. And so it's, as we grow in our understanding of this plant, we can be more and more specific about which compounds are most effective for particular illnesses. Another thing that's really quite important in cannabis science and cannabis medicine is the fact that cannabis plant, as those of you who are familiar with the cannabis plant can attest, it's very aromatic. It is a very fragrant plant. And there are a lot of different varieties of this plant. All the compounds in this plant expresses itself differently in these different, some people use the word strain, but we really call them chemovars or cultivars. So they have these essential oils in them called terpenoids, and these are what give the plants its unique characteristics. Some smell citrusy, some smell skunky, some have a spicy smell, and this is because of the different essential oils or terpenoids in that particular plant variety. And these terpenoids are very medicinally active. I know we had a session on essential oils earlier today. They have a lot of physiological action on the body. And one of the exciting things about cannabis, as we're learning, is that some have more or less of certain kinds of terpenes, and these are a lot of what actually causes the effects. You know, it's how some strains of cannabis will make people feel very sleepy and put you to sleep quickly, or, you know, just want to lie down. Others might make you feel kind of energized and uplifted. People have talked about sativa and indica as these two categories of cannabis that, you know, sativa being sort of the energizing category and indica being the sedating, relaxing one, but that's not really true. Those labels aren't accurate. It really has a lot to do with these terpenes in cannabis. So when somebody comes to me and they, you know, they are describing their different symptoms, I can be thinking about which terpene would be most helpful for this person and help them choose cannabis flowers or products made from the cannabis that are abundant in particular terpenes. So when the ideal cannabis medicine is made from the whole plant, it's not isolating certain compounds necessarily, though that has been done. But what we find is when you take the whole plant and put it into a medicine, either you're inhaling it, or you're putting it in a tincture, or you're putting it in an edible, and you get this synergy of all these compounds working together, and we call that the entourage effect. This is why using the whole plant in whatever kind of medicine you're using is ideal. And I noted here that pharmaceutical medications are usually synthetically made one molecule compounds, most of them. Whereas using botanical medicines in a broad way, but cannabis, as what we're talking about today, is you're getting the benefit of the way nature made this plant, and that these different compounds balance each other out. And I'll give you an example of that, because THC and CBD are the compounds that we're most familiar with. CBD actually helps to tamp down the psychoactive effects of THC. So if you take a high THC product that doesn't have much CBD in it, you might get sedated, or some people get a little anxious, or I'm too stoned, or whatever. But if you add CBD, rather than having just a high isolated or very high THC content, if you add the CBD to your formula, it will help balance that effect. And so just envision this orchestration of compounds in this plant. And remember, people were using it for thousands of years, and they weren't isolating it. They weren't pulling CBD out or pulling THC out, or they're just using it the way the plant naturally presented it and getting tremendous benefit. Here is a list of some of the known medicinal actions of the compounds in cannabis. And again, here we're just looking at THC and CBD, but there are more. There's a lot of crossover. You know, the THC and CBD have similar effects. They work in kind of different ways, but they work synergistically. Cannabis comes in a lot of different forms. If you go to a dispensary, now if you get a medical card and you go to a dispensary, you will discover that there are a lot of different ways that you can use cannabis. You can inhale it, which is, you know, what we're familiar with from, you know, smoking weed kind of a thing. And you can use it as a liquid tincture, which is how it was prepared. That's a very traditional use, a tincture form, just like with lots of other botanical medicines. You know, it's extracted into alcohol or oils and used in a liquid form under the tongue. As a clinician working with cannabis, I use tinctures most with my patients. That's sort of the foundation. And a lot of other cannabis practitioners also use tinctures. You can use very low doses. You can be very specific with how much you're using. And it's a great foundation. So there's oils, there's edibles. If you go to the dispensary, you can get cookies, you can get chocolate, you can get gummies, you can get all kinds of different things. Topical salves, people are using a lot of topicals for arthritic joints. There are skin patches that release the compound slowly, suppositories. You can make tea with cannabis. So there are all these different forms. So when we're working with somebody interested in cannabis medicine, we really do like a very thorough assessment to think about what are we trying to treat? What forms are you interested in? What's your past experience with cannabis? And choose forms that are most appropriate for that particular person. Okay, this is my last slide. Good timing. This is, you know, just a few little pointers I wanted to make sure I touched on, and then we'll just see where the conversation goes here. These are things to just pay attention to if you pursue cannabis medicine. You want to make sure that your cannabis is clean, and by that I mean pesticide free, free of toxic heavy metals or molds or mildews. This is why getting it at the dispensaries can be really good, because they have the medicines have to be tested. So they are lab tested to make sure that they are free of pesticides, free of heavy metals, free of mold and mildew that can cause problems. So get it organic. If you know people, if you don't get it from a dispensary, it's really good to know where your cannabis is coming from, because you don't know what's in it. I can tell you for one thing, and particularly for CBD products on the market, it's a wild west. There is not much regulation, and everything is not created equally. There's a lot of CBD that's what's actually in the product is not at all what's on the label.
That was one of my questions, Nadine, is this like surge of CBD products, especially in the Monadnock area, which I don't personally like ever feel any different when I've utilized them in my healthcare regimen.
Yeah.
So I was curious about how CBD works, but it, you know, for me at least, when you see this thing now turned into a million other things, you know, it kind of loses, I don't know, the potency, or I don't know.
Yeah, it's a big topic.
What I'm saying, yeah.
I understand exactly what you're saying, Shae, and it really is a big topic, and it's a very interesting topic. CBD is a really incredibly active medicinal compound in cannabis, but when it's isolated from the plant, like this is what we were talking about before, when it's pulled from the plant away from all the other compounds that work with it, it loses the synergy of you know, like what we've been talking about, how other compounds work with it synergistically. And CBD can be this is like a whole hour's worth of a conversation. The whole question of where is it coming from? Is it coming from a hemp plant,
I know.
which actually the hemp plant is a more fibrous cannabis plant. It's in the same family, but it's more fibrous and it's not as resinous. The compounds, CBD and THC and the other medicinal compounds come from the female flower in the cannabis plant. The cannabis plant is, I forget what the word is, dioecious or something. There's male plants and there's female plants. And the cannabis flower that we are familiar with, that you see in that picture, comes from the female plant, which is full of resin. And in that resin, on the resin, there's like these little glistening pockets that hold all these cannabinoid compounds that are medicinally active. The hemp plant is very low resin. So because of prohibition, again, which limits how much THC can be in any product that you buy over the counter, a lot of this CBD that is sold on the market is coming from hemp plants that don't have THC in them, because that's what's legal to sell. But you don't have really good high quality CBD coming from hemp. You can get good CBD. There is good CBD out there, but it's not what you find at the gas station and wherever else. And it's not, and there's CBD everything. They're just, it's just like put CBD on popcorn and put CBD in your
exactly
Coca-Cola. And, it's just hype. It's not for real. CBD can be very helpful. Interestingly, there have been studies to show that if you add even a little microdose of THC to your dose of CBD, it will up the effects. So if you've used CBD alone and then, and it's not getting much effect, and you added a tiny bit of THC to that formula, you may find that you get a better effect. The other thing is that CBD has a wider range of dosing than THC. Most THC, it's a narrow window of where it's most effective, what the dose is most effective, a couple milligrams, up to 10, up to 15 milligrams perhaps per dose. But most people can do really well with a very low dose of THC, whereas CBD has a much wider range of dosing. So some people need to go up higher, and they don't go as high as would be beneficial with CBD. But if you add a little THC, you don't have to spend so much money on taking a lot of CBD, because you can enhance the benefit of it with a little bit of THC. I don't know if that makes sense.
Yeah, it does. Yeah.
It's a lot of information. There's a lot of information.
Oh, it's wonderful.
So we just have a few minutes left, I think. So I just want to see if anybody has anything else they want to say, or questions or experience.
Well, the one thing I wrote down while you were talking, because this is such a rich subject, what maybe some resources are for sourcing or learning. And I know, and I can probably find it on your website and share it. I know that you offer consultations on this sort of thing. And so maybe directing people to your website to contact you, that would be the best place to start.
Yes, and you can see it. I've got it down here on the bottom of the slide. It's just NadineHottat.com. Yep, I do cannabis consultations often. As I said, I am able to do certifications for people who would like to get registered with the New Hampshire program, because that's where my license is. So we do, I do consultations to see if somebody is appropriate for using cannabis, and then I provide a lot of education and guidance for using it well. Using cannabis medicine is really different than using it what has been termed recreational. For the most part, it's a very different experience. It's usually most effective medicinally at much lower doses than people are accustomed to using cannabis. Most people, when they use cannabis, smoking it or eating edibles or whatever, really quickly exceed the dose that would be optimal for them if they're using it for medicinally.
Mm-hmm.
So
Yeah.
this is why we hear a lot about microdosing and the whole phenomenon of microdosing with cannabis as well. Very small doses can be much more effective than high doses. You lose the effectiveness when you use too much. So guidance around, and this is what I have down at the bottom, starting low and going slow. You know, I really work with people to find their optimal dose, and that's very, very individualized. There's no cookie cutter formulas. There's no prescription for cannabis. Everybody's all the conditions that the endocannabinoid system is working with are so individual that you can't take one person's dose and try that for yourself. It's very individual. So we start really low, we incrementally work up, watch what you feel, and find everybody has a sweet spot, or it's called a therapeutic window. We get into that sweet spot where in that dose range, you're getting relief of your pain, you're sleeping well. It's incredible for sleep. It's really helpful for anxiety and depression for some people. It can be phenomenal for post-traumatic stress disorder. In fact, PTSD was one of the really the torch that carried cannabis to where it is now, in that particularly veterans, you've all seen stories about vets with their pharmaceuticals, bags and bags of pharmaceutical medications to treat their PTSD, and terrible side effects, and really sad stories. And these people were using cannabis and going, this is working. And these people really championed getting cannabis legal. They're one of the real forces to champion it. So I've used it for pain with patients. I have patients with endometriosis pain, interstitial cystitis, which is a chronic bladder pain, arthritic pain. I have people with, really severe anxiety or depression. I have people with sleep disorders, cancer, people going through cancer treatment, chronic illnesses like rheumatoid arthritis, chronic pain conditions, pelvic pain. You can use cannabis to treat these conditions really effectively with good guidance and understanding how to do it, and avoid some of the real difficult issues with pharmaceutical medications they're commonly used. Another big exciting topic is around opioid withdrawal, helping people with opioid addiction using cannabis. There's a lot out there about this, and it can be really a game changer for people trying to come off opioid pain medications and the addiction that happens for so many people.
Wow.
That's a mouthful, isn't it? There's a lot to cover. It's hard to cover.
Amazing job.
But if I can do anything, it's to make people know that we're talking about a whole nother level of what cannabis is all about than all the fear and stigma. Oh, there's stoners. People are just going to the dispensary because they want to get stoned, or, oh, it's going to, people are going to get addicted, or, oh, it's a gateway to other drugs. There is so much more here, and we need this. Like our medical system is really in trouble for treating, as you know, pain. Like we have a huge problem treating pain in this country and in the world. We have a huge problem treating anxiety in this country. People are really struggling with their coming off medications. Withdrawal from pharmaceutical medications is really difficult. Botanicals, and cannabis isn't the only botanical that's incredible, but botanical medicines are really needed. We need this research. We need these conversations. We need to understand that this isn't just, stoners trying to.
Yeah. Well, I even know that's the image I have in my head is, the joint that you smoke at the end of the day because you're stressed or whatever that might be. And it's so much different than that. And so I think the stigma is so important to eradicate that. And I feel like really good work is being done. Like you said, there's so much research being done on this. And um,
Yes.
when you can point to that, it's so effective towards that cause. And especially with some of these special populations you're talking about, people with PTSD and anxiety and pain. And yeah.
You know, autism, dementia, there's incredible work going on with elders with dementia and Alzheimer's. There are nursing homes that got permission to bring cannabis in their treatments, and there's remarkable benefit for people with dementia, with
Wow.
well used cannabis medicines. And again, remember, you know, there's nothing wrong with smoking a spliff from time to time if that's what you want to do. There's nothing wrong with a little bit of mood elevation, you know, if it's used wisely. You
Yeah.
know, that's a whole nother topic. But even the stigma around that, like where's all the stigma about having a glass of wine? But people smoke a
Yeah.
little bit of a plant, which people have been doing for thousands of years, and all of a sudden it's like this, you know.
Yeah. Yeah. So true.
So yeah, there's a much benefit from this plant if it's used wisely. Yes, it can be abused. Yes, it can.
Mhm.
Um, you know, and there are safety issues to be aware of, but for the most part, it's very safe and really a beneficial plant.
Wow. Well, gosh, we could just talk for hours about this.
Yeah,
I think
I
that's
could.
been the case with, all of these different topics that have been presented so far, but I just love what you've put together for us. Thank you so much for being here and for your wisdom and everything that you've offered to the community today.